Grade 9 Immunizations, what you need to know. Did you know that immunization has saved more lives in Canada in the last 50 years than any other health action? Vaccines are the best way to protect you against many diseases and their complications. And when you get immunized, you help protect others as well. In grade 9, you can get the Tetanus, Diphtheria, and Pertussis, or Tdap vaccine, and the Meningococcal quadrivalent conjugate vaccine. So what are tetanus, diphtheria, and pertussis? Tetanus, also known as lockjaw, is caused by bacteria mostly found in the dirt. When the bacteria enter the skin through a cut or scrape, they produce a poison that can cause painful tightening of muscles all over the body. It's very serious if the breathing muscles are affected. Up to 1 in 5 people who get tetanus may die. Diphtheria is a serious infection of the nose and throat. The diphtheria bacteria are spread through the air by people sneezing or coughing or by direct skin-to-skin contact. The disease can result in very severe breathing problems, heart failure, and paralysis. About 1 in 10 people who get diphtheria may die. Pertussis, also known as whooping cough, is a serious infection of the airways. The bacteria are easily spread by coughing, sneezing, or close contact. Pertussis can cause spells of violent coughing and choking, making it hard to breathe, drink, or eat. This cough can last several months and occurs more often at night. If you have pertussis, you can pass it on to babies, who can get very sick and can even die. Although rare, meningococcal infection can cause serious and life-threatening infections, including meningitis, an infection of the lining that covers the brain, and septicemia, an infection of the blood. Meningococcal infection is spread from one person to another by coughing, sneezing, or close contact. It can also be spread through saliva by kissing or sharing things like food or drinks, lipstick, or water bottles. For every 100 people who get sick, about 10 to 15 may die, even if they receive treatment. Survivors of the infection may lose their arms or legs, have brain damage, or become deaf.
If you have missed any vaccinations as a child, we may offer to catch those up. Those vaccines may include hepatitis A, hepatitis B, polio, HPV, MMR, and chickenpox.
What are the possible reactions after these vaccines? Common reactions may include soreness, redness, and swelling in the arm where you get the shot, headache, fatigue, muscle or joint soreness, chills, nausea, and mild fever may also occur. Medications such as Tylenol or Advil can be given for fever or soreness.
If you receive the MMR or chickenpox vaccines, you may get a rash that looks like measles or chickenpox up to 2 weeks after the vaccine was given. Ask a public health nurse about the reactions that are specific to the vaccines that you are receiving.
It is important to stay in the school for 15 minutes after getting your shots because there's an extremely rare possibility of a life-threatening allergic reaction called anaphylaxis. This may include hives, difficulty breathing, or swelling of the throat, tongue, or lips. If this happens, your nurse is prepared to treat it.
Who shouldn't get the vaccine? People who have had a life-threatening reaction to a previous vaccine or any component of the vaccine, and certain medical conditions or treatments may mean not getting a certain vaccine at all or waiting to get the vaccine. If you're not sure, ask the nurse.
Some people feel nervous or anxious about getting a shot. That's totally normal. Some things you can do to help are taking some deep breaths or distracting yourself with music or a game. And make sure you tell the nurse. They've done this a lot and can often talk you through it. When you were young, your parents made all sorts of decisions for you, including all the decisions related to your health. As you get older, you start making decisions together. Eventually, you have the opportunity to make your own decisions about your health. This is called mature minor consent. The consent form is a record of the decision you and your parents make about immunization. There is a space for your parents to sign, or a space for you to sign if you give your consent. As a mature minor, you can decide to be immunized whether or not you have a consent form signed by your parent or guardian. And as a mature minor, you can seek health care from a doctor's office or primary health care center, a pharmacy, a sexual health clinic, or the public health center. We've covered a lot of information. If you have any questions, please speak with the nurse. Immunization, an important part of your overall health.